So, uh, thank you, Ashley, for starting recording. So I'm Gary Harbison, as I think you all know by now, and Ashley Herman, who has been assisting throughout the conference, is our community outreach and project development director, and she will be helping with this presentation as well. Um, so the idea is to give you both some introductory ideas about uh, advocating for oral health and and maybe some more advanced thoughts that you'll get from breaking into small groups and having some conversation. We'll have some questions to kind of frame those conversations. But we're thinking we haven't done that in this training previously, but we're thinking that will be helpful to people. We usually do this about a couple of weeks before the conference because when we're in person, we have an actual day where people go up and visit at the Capitol. But these are different times, and so we're not doing an in-person visit up at the Capitol. And as a matter of fact, I wouldn't really recommend it at all. But we did want to get the training in here, and we'll actually have some action steps for you as well. This is not a time where you have to stop advocating or doing the things that you think will be helpful. So, see if I can get the slides to advance for me. So just a little introductory stuff. The coalition is a nonprofit advocacy agency. We revised our mission in 2019. It is to improve oral health with all Missourians by advocating for sound public policy. The idea is we used to have the word for all Missourians in the mission statement. There were some other changes too, but that change from for to with is important. And you guys are part of the with. We don't feel like this organization operates outside of collaborative and partnership efforts. So that's part of what we're doing. Our vision is oral health for all Missourians. It's a big order. We don't intend to let go of it. So we're really best described as a statewide network of advocates working to improve Missouri's oral health through systems change. And we have people all over the state working on oral health issues. These are the current policy goals. I'm not going to go through all of these. You can find them on our website, and of course this presentation will be out there. But we're even talking about vaping in the first goal. We identified that as an issue quite a ways back, and actually we were the first statewide organization to endorse the Tobacco 21 initiative. But we do various things on these goals at any given time, though our priorities might be a little bit different than the goals. So advocacy, at a very basic level, it's simply raising awareness about an issue that is important to you. So it's, I think when people come across the idea that they would be an advocate for something, they think it's complicated, and I think at a very basic level, it really isn't complicated. So even if you are talking to your neighbor and or a relative on the phone or whatever, and you start talking about something as simple as community water fluoridation and say only, I think it's great stuff, you have actually engaged in advocacy at that point. Whether or not you moved them or changed their opinion, that's a different story, but that is advocacy, and it's important that we all engage in that. The other aspect, though, it can get pretty complicated pretty quickly. So contacts with state and federal legislators, city council members, county commission members, elected and appointment government members show that oral health is important to you and to Missourians. I would go even beyond that. Uh, Community influencers, uh, really anyone in a decision-making authority is a person that if you do something as simple as stand up and say oral health is important to me and Missouri has a lot of challenges, you've actually engaged in some very good advocacy at that point. People don't hear that much, and it is important to get that in front of people. Um, Advocacy can also be about specific requests. Um, so passing a law, funding a project or a program, or changing a regulation are kind of classic examples of advocacy actions that you might engage in that's a little bit beyond just awareness. That at that point you're asking for somebody uh, to do something, and it's really important that decision makers know that oral health is important to Missourians and important to you as an individual. It's often oral health is often an issue that people forget about or put on the back shelf, and I think this crowd has seen that in many instances. And so when you start talking about this, even in just a very general and friendly way without an ask, that makes it a little bit harder for people to ignore it as an important public health issue and as an important health issue. And but if you go beyond that and you make a request, then you're really doing something. We'll talk a little bit more about that. But without your voice, it's really easy for decision makers to just not even think about oral health or be concerned about it. Um, so we're going to talk a little bit more about talking to a decision maker per se, rather than just general public awareness. So you want to prepare before you talk with a decision maker. It probably will not take you very long because there's so much information on the internet now. Uh, but you want to know a little bit about what their interests are, what their background is. Um, you want to know if as much as you can determine it, what are their priorities? What do they really care about? Why are they a state senator? Why are they a representative? Why are they a city council member? Um, so when you look up a senator or representative ahead of a contact, you can see committee assignments, legislation that they have filed or co-filed. You can see their bio, their photo. It also has their address and phone number. Looks like we got phone number on there twice, but you can get that information so you know how to contact them. The room number is very helpful. What's the address and room number? Room number is very helpful when you're actually walking into the Capitol because it's large and confusing. We're not doing that now, but you do need the room number to mail things to them, and we will talk about that a bit. Um, Decision makers generally understand that they are working in a government position, elected or otherwise, to serve the public interest and like to hear from constituents. That's not always the case. I will tell you, unfortunately, there are times when people approach city council, county commission, representative, and they really get told that their opinion as a constituent doesn't matter. Fortunately, that does not happen much. If it does happen to you, you probably have a pretty good idea. There's no reason in continuing the discussion, and you know something about that person that is very unfortunate. But by and large, most people are very open to these discussions, and they're especially open to hearing from people who are not typically advocating with them or political. In other words, just a citizen. They will especially, though, I think, listen to field experts. So they do want to hear from dentists and hygienists. You're actually out there doing the work. They're going to pay attention to you, and they will listen. And I think one way to approach these things is to think of your contact in terms of longevity. So don't think so much about, I'm just going to talk to this person today and then I'm over and done with it. If you talk to them, in the case of, say, a bill that we want to get passed, and we'll talk a little bit about one here in a bit. Um, if you talk to them about that this session and the bill doesn't pass, next year, or even between session when you talk to them again, it starts to drive home. These people aren't going away. They care about this, and it takes that bill and pulls it up to a little bit higher priority. And that's very important. Every legislative session, there are hundreds and hundreds and hundreds of pieces of legislation filed. And, watching the media, you quickly get the idea that maybe there's like 6 really important pieces of legislation. And there may be just 6 priorities, but there's a lot of other pieces. And if you can kind of point out that this is important to you, it can really make a difference. It might not happen fast. Often the bills that we have been directly involved in, it takes more than one session. I think the one bill that we had passed related to the notification law for public water system fluoridation. I think it took us 4 sessions to get that across the finish line. That was a good thing. So making a connection now can really help later. And again, your voice as an individual citizen can actually carry more weight than people that they see every day. So you might think it doesn't matter. They're not going to listen to little old me. Well, actually, they will. They will be impressed. And I would even include, for those of you who have never done anything like this, it's okay to be a little bit nervous. It's okay to say to them, yeah, I haven't done this before. Because what is that? That says that you care about this enough that you're going to put yourself through some discomfort. And they will be impressed by that more often than not. So obviously, because of the pandemic, we're not asking people to meet in person. They do not have a mask mandate in the House and Senate, and so I think the risk level is high. So we'd recommend talking via phone or writing a letter. I know some people have done like Zoom calls and stuff. I have found the sort of the skill level with that kind of stuff with our senators and reps is pretty low. Many of those desktops in the Capitol building do not have cameras, and so I think that's problematic. A phone conversation is good, and writing a letter I think is really great. If you want to have a phone conversation, you're generally going to have to contact the office and request an appointment. So basically, what do you want to do? You want to introduce yourself and say you are with the Missouri Coalition for Oral Health. You need to remember in a conversation to refer to the legislators as Senator X or Representative X. But legislators do expect to be asked something that's not unusual at all. That might not be the usual thing you do when you interact with other people, but they kind of expect if somebody's coming to meet with them, they've got an ask. So they should be listening for that. I would say the environment, I'm sure many people on here have heard me say this before, the environment in the Capitol is loud and kind of chaotic, even during the pandemic, and there's a lot of things going on. It would not be unusual to get even a scheduled phone conversation interrupted. And I'd even go further. You could have a scheduled phone conversation and you do not get the legislator, unfortunately. We'll talk about that here in a minute, though. They often have many, many issues on their mind. Talk with you about something that is important to me that's completely unrelated. The only thing I'd caution you with that, you want to get a good, clean message. I'm with the coalition. I'm here for this. Here's the ask. If you divert off into these other conversations, either because you have an interest in it or you're just being polite, you need to make clear at that point that you're speaking as an individual, especially if you're taking a position with it. And you need to remember your conversation on an unrelated issue may have an impact on your conversation about oral health. So, for example, you go in there to ask them to pass House Bill 819, and they talk about how much they hate labor unions, and you don't hate labor unions. As a matter of fact, you support them, and you get into a little bit of a debate about the efficacy of labor unions. At this point, you've taken an oppositional view from them, and they may or may not have that spill over on what they're thinking about your position on 819. So just be cautious with that if you get into that. So when on live visits, it often happens that you end up talking with a legislative assistant or other staff. The senators generally have larger staff, so that's not bad. It actually can be good. In some instances, it can be better than talking to the legislator. The legislative assistants will pick up an issue if they connect with it, and they will make sure then that elected official is paying attention to that. They will help them remember that, and that's great. So if you end up having a conversation with a legislative assistant or even another, an intern, don't feel bad about that. Go ahead and press. In the case of the interns, they do use interns up here. An intern, you may be educating them about something they've never heard about. And again, thinking long term, they may end up being a politician someday, and then they can think back on that conversation. Or again, like the LA, they may be very good at keeping that issue front and center for the senator or rep. Quick note: never refer to it LA as a secretary. The casual term is LA. They're not really secretaries, although they may appear to be. You may get a question about something while you're having a conversation that you really can't answer, and that's fine. Just tell them, I don't know, but we'll try to get back with you on that, and then we will have a feedback survey to you, and you can let us know about that. Making a connection on a personal level, I think, is always good. So if you end up talking about baseball for a few minutes, that's okay. I mean, that's sort of a neutral thing for most people, and then you're both baseball lovers, and then you've got kind of a human connection, or maybe geography. Maybe you live in or near the town where they live, and always remember to be polite and thank them for their time. Right now, I think, those phone conversations are great, but right now, I think writing legislators is a really good way. Email, they get too much of that, and it's hard to make your email stick out. Physical letters are not used as much as they used to be used. And so we want to recommend that you're communicating with a legislator. A great way to do that is a letter. And even a handwritten note. I have been a proponent of handwritten notes because that is typically very unusual. Now, please write legibly if you do that, but that will really stand out to people, and that's what you want. You want them to hear what you say, and you want them to read it. And it is important to be clear and to the point and to introduce yourself and all that kind of stuff. But that is a very good way to do that. I know for a lot of people it's easier to type out a letter than hand write things, and that's fine too. I think a hand signature, signing it personally will help. Make sure you let us know if there's follow-up that needs to be done or if you get any type of response. Again, be polite in those letters. You may want to include a copy of our 2021 legislative priorities if you send them a snail mail note, and we'll be able to get those to you. Just a quick thing about addressing envelopes, and again, the slide will be available. So the envelope, the outside, the Honorable Senator Bill Smith, the Honorable Representative Henry Ford. You know, there is a formality and a tradition to this. That is how that is written out. You want to be sure to have that room number on there. Uh, so the state Senate room number, blah blah blah. You know, Missouri House of Representatives room. And you want to have that number on there, and it is Jefferson City 65101. You can find houses, the House and Senate addresses on the website. And certainly, if you have any questions whatsoever, you can get a hold of us through our info@oralhealthmissouri.org account. I want to go over our legislative priorities real quickly. At the beginning of the conference, I mentioned House Bill 819. So our basic frame on that is to support local public water fluoridation decisions or to support local decision making. And, you know, this was filed by Representative Wayne Wallingford from the Cape Girardeau area. It's actually Cape Girardeau County. He's in the Jackson area. He was a senator and has filed this bill for us twice before, so this is the third year on this bill. So really, it'll ensure that the local people have the benefit of the input from their county health department in considering public water fluoridation. You would like to think that if there is something that would impact public health, that the decision-making body would automatically request information from the only local agency that's designed to protect public health. Doesn't happen at all. Matter of fact, in all of these legislative battles, I've only heard of one instance in Missouri where the city council requested that the health department provide information. So this is a very moderate bill that will not impact where that decision is made. We do not believe it's viable in the state of Missouri to say have a public water system fluoridation mandate. And we think there's some treachery in introducing it. So we have never gone that route. The bill that we had passed previously, the notification bill, has been very, very helpful. We think we can get this one passed, and we think it will also be helpful. It will support local decision making, as we say, and it will also support the county health department in being involved in something that they should be involved in, at least as an expert. So that is supporting House Bill 819 is one thing, and by the way, that has moved right along. He filed it after session started. It has. Without going into why it is this way, this is how it works. It's first and second read in the full House. Then it is referred to a committee. Then there's a public hearing. Then it is voted on by that committee, and it has been through that process. It's been voted out, and in the structure now, there's like a rules committee, and it goes through the rules committee, and they just vote it out of that. Where we're wanting it to go now is over to the full Senate. We hope to see that. I want to thank you all. I don't know how many on here submitted testimony in support of HB 819. But yeah, Aaron did. But we had, so in this day and age of COVID, our call was to submit supportive testimony online, and they have made it easy to do that. And 21 people did that, and I believe representatives of the MDA and MDHA were both physically present for the hearing. The bill got a lot of support. It had no opposition. It passed unanimously out of the committee, and I think that showing of 21 people doing that just really is excellent. And thank you all so much for doing that. That was a great response. And we should have a chance to do that again on the Senate side. there should be a hearing. Again, it'll be first and second read. It'll go to a committee, and there should be a public hearing at that point, and we'll keep you advised and put a notice out about that. The other things that we're going to have on the priority list are continue to fund Medicaid adult dental benefits and expand to include comprehensive benefits. Um, so in years past, we've talked more about continuing to fund adult dental benefits, and that's probably all we're ever going to get with it. But we wanted to start raising that a little bit more, so formally putting it in here with a few bullet points. Um, we wanted to do that, maybe set the stage for some further work a little bit later down the line. And then finally, I think there was another session where we talked a little bit about Medicaid provider rates being so abysmal. They continue to be horrible. If we want to increase access, especially going into Medicaid expansion, we really have to figure out a way to get those rates up. Again, very hard sell. We still want to say it though, and who knows, somebody might latch onto it and come up with a great way to address that. So those are our priorities, and I think Ashley's going to jump in here now in relation to the action steps.
Yeah, so we have a couple of longer term action steps and then a few things that we're going to do in breakout sessions still this afternoon. So we really want you in the next 2 weeks to compose and send a letter to your senator and your representative, or hold a phone call with each. That way we can have those personal touches that we aren't able to achieve by being in the Capitol this year. And we also ask that you please complete the survey to record your actions and to provide any additional information or feedback to us about your visit. If there's anything additional that you discussed with your senator or representative that you need us to help fill in some gaps or provide additional materials, we're always happy to do that. Next slide, Gary. Then in the short term, we are going to do one more breakout session for the conference today. And we know that there are various levels of advocacy skills within our group. So we have some who have been to the Capitol multiple times, others who may have never have had a conversation with the legislator. So we want to break you out into groups that are pretty random so that you have an opportunity to share your experiences, your thoughts, anxieties, your questions within those groups to help learn from each other. So we want you to know that your voice can make more of a difference than you've ever imagined. Some of these bills that have been through, not necessarily oral health bills, but other things, is as little as 2 or 3 phone calls to these elected officials to help them get a good perspective on why that bill is important. We know that working together, the sky is always the limit, so it's better to have additional people than just 1 or 2. There are no bad questions. So there's no bad questions. There are really no wrong answers. Everybody kind of has a different way and approach to advocacy, and it's great to learn from everyone involved. Anxiety, there's always something about anxiety whenever there's something new. So it's just kind of par for the course, and we kind of work through it. And the first couple of times might be a little uncomfortable and a little rocky, but we always get better with it with practice. And again, we have some people who have a lot of experience and some that have none. So that's kind of learning on each other's experiences. So we've got 3 questions that we're going to work through in our breakouts, and we'll put those in the chat here in just a second so that you can copy those over and take them with you. But think about what successes and challenges have you had in previous legislative visits. So for those who have been on legislative visits, what successes and what challenges have you had? What concerns do you have in regards to talking with elected officials? And how can the coalition better assist you in your advocacy and outreach efforts? So we're going to give you about 20 minutes to talk in small groups, and then we will reconvene as a large group and have a debrief and go through just a couple more final steps. I went ahead and put those questions in the chat, and I will pop into each of the breakouts and copy them over as well in case somebody in your group doesn't have a hold of them. And we will.
I want to make a footnote. I think there are some state employees on here. I think if you are in government you have to think carefully, a little bit more carefully than other people about what could be problematic for you or not. I have to say, most of the time when I worked for state government, it was frowned upon for a state employee to take a position on even on things that are completely unrelated to their area or the department they work for. That seems to be a little bit less of an issue in this day and age in Missouri, but I still it's something that you should think about.
Thanks for reminding us about that one, Gary. I always forget that we have several state government employees within our group. All right, so I am going to start our breakout groups now. Dr. McCunniff, is yours being difficult?
Yep.
Give me a
I
second. Let me
figured
see.
nobody wanted to be with me, I guess.
Oh, that's not true. Let's see if this works.